Good morning, good afternoon, and good evening to all our viewers from all over the world, universe rather. First and foremost, I would like to extend my sincerest gratitude to the organizers of this webinar, especially to Dr. Michael P., our dear webinar chairman, for having me today. My topic is on antimicrobial resistance and how it fits in the COVID-19 picture. The early part of this topic will tackle on antimicrobial resistance or AMR per se. Then it will be followed by a brief discussion of the different efforts of the tripartite agencies, namely World Health Organization, United Nations Food and Agriculture Organization, and the World Organization for Animal Health or OIE, not to forget the local programs that we have happening on the ground. Next will be the discussion on how AMR is related or connected to COVID-19. Lastly, I will wrap it up with some take-home messages about AMR. As defined by the World Health Organization, AMR is the resistance of a microorganism to an antimicrobial previously effective for treatment of infections and diseases caused by it. The growing concern on AMR involves the overuse of antimicrobials, which include non-observance of the withdrawal period of meat and milk. Moreover, extra-label use or off-label use of antimicrobials is also rampant. The care for extra-label drug use in food animals relate to residue avoidance, and its use requires documentation of adequate withholding period of milk and slaughter to ensure food safety. Extra-label use is prohibited if the use results in the presence of drug residue in food or if it presents a public health risk. WHO lists the major causes of antimicrobial resistance, and as previously shown, the animal sector plays a substantial role as according to the Center of Disease Control or CDC in the United States of America, 80% of all the antibiotics are used on factory farm animals. For the human part, the popular ones would be patients taking up medication up to only the middle of it, or taking it without having the need for it, and of course, the lack of hygiene and sanitation, whether voluntary or not. Let me show you how AMR works. The mechanism on how it happens are shown. We have enzymatic drug inactivation, reduced intracellular accumulation of antimicrobials, and the protection, alteration, or replacement of the cellular target sites. And this is a very good illustration of how antibiotics work and how the resistant pathogens evade and or overcome these antibiotics through the various mechanisms of resistance shown on the purple side of this picture. How is this made possible, you may ask? So this would be through the acquisition of resistance genes, either through mutation or horizontal transfer. Moreover, horizontal transfer can be through these three methods. Transformation is like the famous saying, finders keepers. So a pathogen can take up any free DNA that comes its way. Everybody likes things that come for free, right? Secondly, transduction involves a bacteriophage, which is a virus that injects resistance genes into pathogens. I look at it like a mass shooting wherein a villain causes a frenzy in the neighborhood and shoots everybody. So that doesn't sound and look pretty, right? Lastly, we have conjugation. Since we are now in the Yuletide season, it's like two entities. whether they are related, friends or not, who happen to be generous enough to share their resistance genes. So I think most often than not, the recipient doesn't like the Christmas gift of a resistance gene or two, but it doesn't have a choice but to accept. So what are we doing now? Now we come to the various efforts of the agencies involved in tackling AMR. The OIE promotes the responsible and prudent use of antimicrobial agents in terrestrial and aquatic animals so as to preserve their therapeutic efficacy and prolong their use in both the humans and animals. They have established and released the international standards for AMR control and global database on antimicrobial agents intended for use in animals. They have organized two global conferences on AMR and prudent use of antimicrobial agents in animals. They have conducted numerous workshops worldwide, including here in the Philippines. A wide range of international standards and guidelines in this field have been developed to provide a framework for responsible and prudent use of antimicrobial products in animals and for the surveillance and monitoring of the quantities used. These standards have been adopted by the OIE member countries and are regularly reviewed and updated in line with the latest scientific findings. The OIE has a global action plan with objectives aiming to improve awareness and understanding, strengthen knowledge through surveillance and research, support good governance and capacity building, and encourage implementation of international standards. Such plan involves strategies that would monitor the judicious use of antimicrobials, measure trends over time, trace global circulation and use patterns, and evaluate the quality and validity of the available antimicrobials. One Health approach is employed by the tripartite agencies by aggregating the data from the human, animal, and environmental sectors. In May 2018, OIE updated a list of antimicrobial agents of veterinary importance. Both the WHO and the FAO also participated in this task. The list takes into account concerns for human health as well. To know more about this, I have furnished a link to the document at the bottom of this slide. A year prior, the WHO released their own revised list of critically important antimicrobials for human medicine. I have also furnished a link to the said document at the bottom of the next slide. Currently, 135 countries already finished with writing their national action plan against AMR, and 50 countries are in the process of developing their own. The tripartite agencies have numerous joint expert meetings, and their general recommendations are as follows. Antibiotics included in the WHO critically important antimicrobials for human medicine are aminoglycosides, carbapenems, quinolones, polymyxins, third and fourth generations of cephalosporins, to name a few. Now, how about the local efforts? Thankfully, we are included in the aforementioned 135 countries already with a national action plan. As one with One Health approach, our plan on AMR involves the Department of Health, Department of Agriculture, Department of Science and Technology, Department of Trade and Industry, and the Department of Interior and Local Government. National Action Plan tackles the following One Health approach key areas, which include that of regulatory frameworks, research and surveillance, implementation and practice of agriculture at par with international standards, and judicious use of antimicrobials in line with the global recommendations and standards. We also have the following Republic Acts and Joint Administrative Orders in place. RA 9711 or the FDA Act of 2009, RA 10611 Food Safety Act of 2013 and creating an interagency committee, Joint Department of Agriculture, Department of Health, Administrative Order number 2013-0026, RR on veterinary drugs and products, veterinary biological products, and veterinary drug establishments. And just last month, we have celebrated our Philippine Antibiotic Awareness Week with the following activities. What does AMR have to do with COVID-19? COVID-19 is a pandemic and everyone has been affected by it. Like this pandemic, AMR is a serious threat to humanity. It has a global spread and is dubbed as a silent pandemic, already happening for decades and is slowly felt in a longer period of time. Unlike COVID-19, when it all happened so fast, but this doesn't mean that AMR is less deadly. Trying to be optimistic, at least with COVID-19, we can see an end to it. There's closure for this since it is just one disease. Whether it be next year, in 2022, or thereafter, immunity can be built. Which eventually shows the disease slow down. With AMR, it is a continuous battle since numerous pathogens develop new resistance genes and they share it amongst them. This is the recent decade timeline of AMR. At this time, we are now dealing with superbugs spread across the globe. According to the World Health Organization, if without prompt action by 2050, we'll have 10 million deaths per year. 3.5% reduction in the gross domestic product, and 28 million people forced to poverty if nothing will be done to change this. Learning about this AMR should be treated with urgency and scale. Same as COVID-19, no single country can be safe from drug resistance infections until all countries take action. And let me make this clear, AMR did not stop because COVID-19 happened. Therefore, our efforts for AMR should continue amidst COVID-19. Luckily, they share some common grounds. Same with COVID-19, AMR can be hospital or community acquired. Addressing both should take the whole of society and the whole of government with a proactive One Health approach. The strategies should be prevention focused, should help increase public awareness, involve fast diagnosis and good surveillance programs to be supported and implemented with and by good leadership or governance. Happily, this occurred or is currently happening with the fight against COVID-19. Some, if not most of it, is yet to happen for AMR. Let's start with the preventive measures. A simple hand washing can go a long, long way. This has been advocated by the Department of Health together with our local hospital network. I've seen promotional videos of our human healthcare workers demonstrating and dancing to a lively tune to encourage and engage people of all ages to establish this habit. This is one of the many ways we can do to prevent both AMR and COVID-19. This helps reduce the treatment of non-infections and non-bacterial infections and prevention of infections altogether. Let us bear in mind that prevention has an impact not only on the individual but on the community, humans, and animals alike. Another way is the employment of good antimicrobial stewardship involving the reduction of antibiotic consumption. To give you a concrete example, as stated by Hanan Bakri, Assistant Director General of the World Health Organization, you don't give your loved one an anti you don't give your loved one an anti-cancer or hypertensive drug unless he or she was diagnosed by it, right? But how come you gave an antibiotic to your loved one as a gastric cleanser or a growth promotant and you called it caring for your loved one? I hear Alanis Morissette singing in my background. Isn't it ironic, don't you think? Isn't it? So let me reiterate that the same goes with the animal sector, that it is unto very few countries was a common practice to feed antimicrobials to animals as a gastric cleanser in order to promote growth. And where do we sit? Still at a no-ban policy. Now, incorporating it in the COVID-19 context, if an individual comes to the hospital for infection, do we give them antimicrobials? Unfortunately, this is the case. According to this article by Biomorose, several inpatient COVID-19 patients have been receiving antimicrobials, even if few of them actually have bacterial co-infections or secondary infections. This unnecessary administration of antimicrobials to patients contributed to the spread of AMR. Some studies have shown that antibiotics have been administered to the majority of inpatient COVID-19 patients and 80 to 100% of COVID-19 patients in the ICU. And as of present time, 1 in 3 of the antibiotic prescribed in human outpatient setting is unnecessary. Let us put more value on antimicrobials so that we use less of it, so that we do not use it extensively. Now we proceed to awareness. It was found out that one of the gaps in the success in the fight against AMR in low and middle income countries include public awareness. AMR may come as an abstract to others. A challenge exists on how to communicate it properly. There is a big room for improvement on client education through advertisement, social media, and the like. Unlike in AMR, COVID-19 measures were communicated to everybody and majority, if not everybody, participated. Everybody talks about COVID-19, but not AMR. Thus, we need stronger engagement. COVID-19 seems to have a face, or more faces for that matter, to represent it, but not AMR. The latter has to have more representations, otherwise it would just be perceived as numbers. Such presentations open people's eyes into the grim reality of the massive effect of AMR. Patients, as equal stakeholders, serve as faces of AMR. I encourage you to learn more about the story of Vanessa Carter, who, after surviving a terrible car accident and has underwent numerous reconstructive surgeries, developed a MRSA infection. Fortunately, she survived and had been an AMR advocate ever since. Another famous face to look for is Miss Tamarine Green. Miss Universe 2018 first runner-up to Catriona Gray. She's also an AMR advocate as she survived tuberculosis. And same here in the Philippines, we also have a big battle for fight against MDR-TB. We need a systematic, dynamic, and structured One Health approach that is applicable and involves the global, regional, and local levels. Yes, even the local levels. Yes, more so the local levels, because the local data will help prevent new cases, co-infections, and keeping an eye directly on antibiotic drug resistance. So we need leadership for each level and collaboration with various stakeholders and global mobilization to address it. Next point will be on diagnostics. We need to know better to do better. This infographic shows how fast and proper diagnosis helps in the fight against these two pandemics. If we need to have faster diagnostics with COVID-19, much more with AMR, as the latter has an unacceptable long test turnaround time. There is a huge gap to fill when it comes to diagnosis, as testing for resistant infections remains underutilized and AMR diagnostics are a decade old already. With COVID-19, the lack of capacity for diagnostics for AMR was tremendously highlighted. Now, this question remains. If an individual comes to the hospital for COVID-19, do we simultaneously screen for AMR, like carbapenem resistance of Enterobacteriaceae, because they have high massive infections, leading to high massive mortalities as well? The answer is yes. I hope that we have the capacity to do so. We come to the last point, which is on the surveillance systems. Contact tracing has been critical in the COVID-19 disease monitoring, which helps the healthcare facilities to prepare for peaks, government to deploy their programs, and for the general public to adjust to the new normal. The response strategy was based on epidemiology. It was based on exposure and not on symptoms or infection. And while most, if not all of this data for COVID-19 is available, it remains to be a different picture when it comes to tracing the spread of AMR infections. It is important for us to know where we are and where we have to go. This includes understanding the scope of the disease to create the attention needed for AMR. Showing you now is the global antibiotic resistance levels as a whole, which is on the map on top. And the one at the bottom is specific for E. coli resistance. We somehow sit at the middle. AMR surveillance is necessary in the fight against COVID-19. The AMR data helps in prevention of new infection and co-infection and emergence of AMR in our COVID-19 patients. In addressing both pandemics, we need not only the public, but also political engagement. Good governance plays a pivotal role in this. For several countries, this happened for COVID-19, but is yet to happen more to move the AMR programs forward. COVID-19 came to us as a massive surprise. Everybody wasn't prepared for it. It literally changed the way we do things. Knowing and experiencing its consequences, we now have a better appreciation of an emerging infectious disease, what it can do and how it can dramatically impact our lives in ways we never appreciated before. Therefore, going forward, we should take preparedness and preventive measures more seriously. To summarize, AMR and COVID-19 may be two different concerns, but both share several similar issues and strategic measures. Best practices to address them should be shared, and with due public and political engagement in all levels, the implementation of such measures would greatly address these two pandemics. my parting statement, let me borrow the words of Dr. Martin Blaze of the University of Minnesota when he said that when you give a cancer drug, it affects the patient. But when you give an antimicrobial, it affects the world. Thank you for listening and staying with me up to the end. I hope you learned something or two. Let us all be safe, live long, and have a Merry Christmas and a Happy New Year.